on a new multi-targeted tyrosine kinase inhibitor in advanced radioactive iodine refractory differentiated thyroid cancer.
Thank you, Mr. Chairman. Good morning, everybody. So I am the second French speaker coming from Gustave Roussy in Paris. It's my pleasure and honor to present this in the behalf of these co-investigators from all over the world. And this SELECT study is a phase 3 randomized, double-blind, placebo-controlled trial of lenvatinib in patients with radioactive iodine refractory differentiated thyroid cancer. The rationale of this study is that a very small subgroup of patients with thyroid carcinoma have refractory disease at the metastatic stage. And for these patients, we have a poor survival rate of only 10% at 10 years. And until recently, there were very few therapeutic options. So the VEGF signaling networks have been implicated in tumor angiogenesis and are associated with the aggressiveness and metastasis of thyroid carcinoma. Lenvatinib, an oral multi-tyrosine kinase inhibitor of VEGF receptor, FGF receptor, and PDGF receptor, has a very potent activity, clinical activity, in a phase 2 trial. So this phase 3 trial was set up some years ago to compare the efficacy of lenvatinib and its toxicity as compared to placebo. The design of the trial was very classical. 392 patients were enrolled, all had refractory disease, with measurable disease, with independent radiological review, evidence of progressive disease within a year before inclusion. And some of these patients had already been treated with a VEGF receptor inhibitor. They were stratified and randomized 2-to-1 to lenvatinib, 24 milligrams per day, peros, or placebo. And this treatment was maintained until disease progression, confirmed by independent radiological review. In case of progression, crossover was allowed. So the primary endpoint was PFS, the time between randomization and evidence of progression by IRR. So the main result is an extraordinary improvement of PFS from 3.6 months in the placebo arm to 18.3 months in the treatment arm. So the benefit is more than 14 months. Furthermore, we had a high objective response rate of 65% with some complete responses. Interestingly, the time to objective response was only 2 months, so responses occurred very quickly during the course of the treatment. Treatment emergent adverse events occurred in almost all patients and mainly consisted in hypertension, in some proteinuria, diarrhea, fatigue, asthenia, decreased appetite, nausea, and vomiting. And this led to dose reduction in about 2/3 of patients and to discontinuation of treatment in 14% of patients. Fatal events occurred in 20 patients, not related to progressive disease, and these were assessed to be treatment-related by investigators in 6 patients. So the conclusion of this study is that lenvatinib is extremely efficient in patients with refractory resistant thyroid carcinoma resistant to radioiodine treatment at the stage of advanced disease. It prolonged median PFS by 14.7 months, the objective response rate is high, 65% with complete responses. The median time to objective response for lenvatinib is 2 months, so responses are very rapid. The median duration of response was above 9.4 months in 3/4 of patients. Finally, toxicity of therapy, although considerable, could be managed with dose modification and medication. Thank you.